Your body speaks to you every day, not always in words, but in signs, and sometimes those signs are strange, subtle, and easy to ignore. One of the most overlooked yet essential nutrients your body needs is vitamin B12. It's the fuel behind your energy, your focus, your nerve health, and even how your heart and skin function. Yet millions of people around the world walk around with a deficiency and don't even know it. Why? Because the symptoms don't always shout, they whisper. A little tingling in the hands, a swollen tongue, or unexpected fatigue might not seem serious at first. But these quiet signals could be your body's desperate cry for help. Even more unusual signs, like vision changes, memory lapses, or dizziness, may not raise alarm bells, yet they are clear indicators of a deeper problem. The real danger is that if you miss these warnings, the damage can become permanent. That's why understanding these strange signs is not just useful, it's potentially life-saving. In this guide, you'll uncover 8 strange ways your body may be begging for vitamin B12. These aren't just random health complaints, they're messages from your nervous system, your blood, and your organs. The good news? Most symptoms can be reversed, and your body can bounce back stronger, if you catch them in time. So, if you've been feeling off lately without knowing why, the answer might be hidden in your vitamin B12 levels. Let's decode the signs together. 1. Tingling or numbness in hands and feet. Vitamin B12 plays a major role in nerve health, and when levels fall too low, strange sensations like tingling or numbness may occur. This happens because B12 helps form the protective sheath around nerves known as myelin. Without enough B12, nerves start to misfire or become damaged, causing unusual feelings. People often describe it as pins and needles in their hands, feet, or even around the mouth. These symptoms may appear suddenly or become more frequent over time. If not treated, this nerve damage can become permanent. The tingling usually starts in the extremities because the longest nerves are affected first. It may also worsen during rest or at night. This type of symptom might be misdiagnosed as another issue such as diabetic neuropathy or anxiety. However, if the person does not have diabetes or shows no clear cause, a B12 test might be needed. Many people are surprised to find that this common vitamin deficiency is behind their strange nerve sensations. Those most at risk include vegetarians, older adults, and people with digestive issues. If you begin experiencing regular tingling or numbness, it could be your body's unusual way of asking for more vitamin B12. Supplementation or dietary changes may reverse this symptom within weeks. However, long-term deficiency can lead to lasting damage. Paying attention to this early warning sign could protect your nerves and help you stay mobile and comfortable. 2. A swollen, smooth, or beefy red tongue. One of the lesser-known signs of vitamin B12 deficiency is an inflamed or swollen tongue. It may appear smooth, shiny, and red, often described as beefy. This condition is known medically as glossitis, and it occurs because B12 is crucial for producing healthy cells and tissues, including those in the mouth. When your body lacks B12, the tiny papillae that give the tongue its rough texture can disappear, making it look unusually smooth. This might also cause discomfort when eating spicy or acidic foods. In some cases, the tongue may feel sore or burn without any obvious injury. People might also complain of a strange taste in the mouth or a reduced ability to taste food. In addition to changes in appearance and texture, cracks at the corners of the mouth can also appear, adding to the discomfort. This sign is often missed or misdiagnosed as an oral infection or an allergy. However, if the tongue changes without other explanations, it may signal a deeper nutrient deficiency. Addressing this symptom early by increasing B12 intake can often bring noticeable improvement in just a few weeks. Ignoring it may lead to further complications like difficulty chewing or speaking. Those at risk include the elderly, people with poor absorption, or anyone on a strict plant-based diet. If your tongue suddenly changes in color or feel, your body might be trying to tell you it needs more B12 support. 3. Unexplained fatigue even after rest. Constant tiredness, even after a good night's sleep, could be a sign that your body is low on vitamin B12. This nutrient plays a vital role in the production of red blood cells, which carry oxygen throughout the body. Without enough oxygen, your muscles and organs cannot function at full strength. This results in a sluggish feeling, both physically and mentally. People with B12 deficiency often report feeling drained, even when doing simple daily tasks. They might sleep longer than usual but still wake up feeling unrefreshed. This isn't just normal fatigue from overwork. It's a deeper, more persistent sense of exhaustion that lingers throughout the day. In some cases, it can mimic symptoms of depression or chronic fatigue syndrome. The fatigue may be worse after physical activity or may come with shortness of breath and a racing heart. This is because the body is trying to compensate for the lack of oxygen in the blood. If a blood test confirms a B12 deficiency, treatment with supplements or dietary changes often leads to significant improvements in energy levels. People usually begin to feel more alert and active within a few weeks of correcting the deficiency. However, if left untreated, the condition can worsen and affect the heart and nervous system. Unexplained tiredness is a strange but important signal that your body may be lacking this key vitamin. 4. Vision disturbances or blurry sight. Strange changes in vision, such as blurred or double vision, could be more than just eye strain. They may point to a vitamin B12 deficiency. This happens when a lack of B12 damages the optic nerve or the blood vessels connected to the retina. Without enough B12, the communication between the brain and the eyes may begin to falter. People may see shadows, have difficulty focusing, or feel that their sight dims unexpectedly. In more serious cases, vision loss may occur in one or both eyes. Some people also describe feeling pressure behind the eyes or seeing light flashes. These issues often confuse patients, who think they need new glasses or worry about neurological problems. Eye doctors may even find nothing wrong during routine checks, especially early in the deficiency. The real cause lies in the nervous system and its need for healthy B12 levels to maintain function. When detected early, B12 supplementation can help restore vision over time. In some cases, however, the damage may become permanent. This symptom is especially important for older adults or those with absorption problems to recognize. If your eyesight starts to blur or you notice unexplained visual changes, it's worth checking your B12 levels. Your body could be signaling a silent but dangerous lack of this essential nutrient. 5. Memory problems or brain fog. Difficulty focusing, forgetfulness, or general brain fog can all be strange but clear signs that your body is running low on vitamin B12. The brain relies on B12 to produce neurotransmitters and to maintain the myelin that protects nerve cells. Without it, cognitive functions may slow down, leading to confusion, poor concentration, and memory lapses. People often report feeling mentally cloudy or unable to recall recent events. This may be mistaken for early dementia or simply attributed to stress. However, in younger adults, such issues should raise concern about nutrient levels. Students or professionals may find it harder to perform tasks they once managed easily. Thoughts may feel slower and decision-making becomes difficult. Mood changes such as irritability or depression may also accompany the mental symptoms. The decline in brain function often occurs gradually, so people may not notice it until it becomes significant. Blood tests can reveal low B12 levels, and with proper treatment, many people experience dramatic improvements in mental clarity. In fact, some doctors refer to vitamin B12 as a brain vitamin because of its importance in cognitive health. If left untreated, long-term deficiency can lead to serious neurological damage. Anyone experiencing unexplained memory issues or trouble thinking clearly should consider B12 levels as a possible root cause. 6. Feeling off balance or dizzy. Vitamin B12 plays a key role in maintaining your nervous system, especially the parts that control balance and coordination. When B12 levels are too low, your brain and nerves may not communicate properly, leading to strange symptoms like dizziness, lightheadedness, or a floating feeling while walking. This isn't the same as the dizziness from spinning or fast movement. Instead, it may feel like the ground is shifting or your feet aren't steady. Some people also experience trouble standing up quickly, feeling faint, or losing balance when walking in a straight line. These problems often show up without warning and can increase the risk of falling. For older adults, this can be especially dangerous. The body uses B12 to protect nerves, and when those nerves are damaged, the brain may get confused signals about your position. In severe cases, the person may need to rely on furniture or walls to avoid falling. This balance issue is sometimes misdiagnosed as vertigo, an ear infection, or a circulation problem. However, if standard tests are normal, a simple blood test for B12 could reveal the true cause. After treatment, many people notice rapid improvement in coordination and movement. Dizziness related to B12 deficiency can fade within weeks once the deficiency is corrected. However, the longer the body is deprived of B12, the greater the risk that nerve damage will become permanent. That's why any unusual unsteadiness should not be ignored. It might just be your body's quiet cry for more vitamin B12. 7. Shortness of breath or heart palpitations. A deficiency in vitamin B12 can also affect your heart and breathing. One strange but serious symptom is shortness of breath, especially during mild activity. People with low B12 may also experience heart palpitations, a racing or pounding heartbeat that seems out of place. These issues occur because B12 is essential for producing red blood cells, which carry oxygen throughout your body. When B12 is low, you produce fewer and often abnormal red blood cells. As a result, your tissues and organs receive less oxygen, and the heart must work harder to compensate. This can lead to a sensation of breathlessness, even if you're just climbing stairs or walking. The body may also feel tired and weak during physical effort. In severe cases, the skin may become pale or the lips may appear bluish, indicating a lack of oxygen. These symptoms can be mistaken for asthma, anxiety, or heart problems. While those are also valid concerns, they should not rule out the possibility of B12 deficiency. A blood test can confirm low B12 and identify any associated anemia. Once treated, breathing and heart rhythm usually return to normal within a few weeks. However, ignoring these signs may result in worsening fatigue, poor circulation, and even permanent heart strain. So, if you're out of breath more than usual or feel your heart racing without reason, don't dismiss it. It could be your body's way of telling you it needs more vitamin B12 to function properly. 8. Yellow or pale skin, jaundice. Another strange but telling sign of vitamin B12 deficiency is the appearance of pale or yellowish skin. This is not a typical sun-deprived paleness. Instead, the skin may take on a slightly yellow hue, often accompanied by a yellowing of the whites of the eyes. This condition, known as jaundice, occurs when the body struggles to produce healthy red blood cells due to lack of B12. Instead of being properly formed, these blood cells break apart easily, releasing a substance called bilirubin. When too much bilirubin builds up in the body, it causes that yellow discoloration. At the same time, the lack of red blood cells makes the skin look less pink or vibrant, adding to the pale appearance. This combination can make someone look unusually sick or tired, even if they feel okay. It's a subtle change, but noticeable to people who see you often. Yellow skin is often associated with liver issues, but if liver tests are normal, low B12 could be the missing link. Doctors may not immediately suspect a vitamin problem when they see jaundice, which is why it's important to mention any other symptoms like fatigue or brain fog. Once the deficiency is treated, the skin usually returns to a normal tone, and red blood cell production improves. But if ignored, the ongoing destruction of blood cells can lead to more serious problems. So if you've noticed your skin or eyes looking oddly yellow or pale, don't overlook it. Your body might be using your skin to send a vital message. It needs more vitamin B12 now. Vitamin B12 is not just another nutrient. It's a vital piece of your body's puzzle, affecting everything from your energy to your brain and nervous system. The signs of deficiency often start quietly, showing up as strange sensations, unexplained fatigue, memory issues, or changes in how you see, move, or even feel emotionally. These symptoms may seem unrelated at first, but together they form a pattern that should never be ignored. The good news is that most vitamin B12 deficiencies can be corrected with timely action. Whether through diet changes, supplements, or medical treatment, restoring your B12 levels can bring dramatic improvements. From clearer thinking to better balance, from steadier breathing to healthier skin, the benefits of addressing a deficiency can be life-changing. If you recognize any of the strange signs we discussed, like a beefy tongue, blurry vision, constant dizziness, or even yellowing skin, it's time to listen to your body. A simple blood test can reveal if B12 is the missing link in your health. Don't wait until the damage becomes permanent. Early detection and care are key to recovery and long-term well-being. Your body knows when something's wrong. All you have to do is recognize the signs and respond. Vitamin B12 may be the quiet hero your body has been waiting for.